Marley Brodsky is a proud mom of two, licensed health educator, and the visionary founder and CEO of Med Companion, celebrated by Psychology Today for her groundbreaking contributions to personalized care and recognized by Forbes as providing the human RX prescription. Marley is redefining how parents, patients, families, and doctors work together and experience healthcare. Through Med Companion, she has introduced a revolutionary addition to the healthcare team, a virtual Med Companion that simplifies the complexities of care, empowering individuals to navigate their health with confidence and clarity. I'm so incredibly grateful to have her on. I met Marley, wow, like a year ago at a mastermind, and she just couldn't be more aligned with what we talk about here on Stress Free Solutions. I know a lot of you have aging parents or have someone that you can't always be there 100% for because of all your obligations with work and life. So I'm really honored to have Marley share this with you. And I hope it brings you some relaxation and joy. Marley, thank you for coming on today.
Thank you, Sarah, for having me. I am so excited to be here.
Yeah, I just think your whole journey has been fascinating. You've had a lot of careers, as many entrepreneurs do, to help you find and kind of narrow down on what you really are passionate about. So I'd love to hear from you. How did Meg Companion come about?
Yeah, as you mentioned, I have gone through many different evolutions trying to find my purpose. And I would say that initially it all started with me wanting to become a doctor. And then, unfortunately, getting a brain tumor at the age of 18. So, as a result of that, not being able to get the grades that I needed to go on to medical school. And then working in corporate healthcare for 17 years as a medical scribe executive for the largest company, having the opportunity to pioneer medical scribes, transcriptionists in various healthcare systems, and really just setting that standard for what it looked like to have a medical scribe in the outpatient space in different clinics, and having the opportunity to grow that into this movement of over 4,000 locations, scribes in
Wow.
Canada, scribes in Australia, and working side by side with thousands of doctors in numerous different specialties and really understanding the healthcare space that way. But one thing I noticed during that time was just the continuous confusion patients faced when leaving the doctor. They
Mhm.
sit at the doctor's office, they nod their heads, they listen or try to listen, and then they're told a devastating diagnosis, or they're told that they have cancer, or something comes out that all of a sudden everything else that follows is forgotten. And even though I saw it time and time again, I didn't truly understand it. And it wasn't until I experienced it myself with my grandmother, watching her be diagnosed with cancer, watching her struggle in her journey to understand what the doctors were telling her, to keep up with her multiple appointments, to keep up with her medications, to keep up with her biopsies. It was just a lot. And having been in the healthcare space, I used to talk to her. I used to try to get information from her, but it was always very fragmented because I was only getting what she would tell me or what she would remember. And I always just wish I could have been like a fly on the wall during that medical appointment to understand what was going on. And once she passed, it was that grief that really brought me back to my purpose. When I thought about why I wanted to be a doctor, the number one thing was I always wanted to help people. And when I started to think about myself as an advocate for my grandmother, myself as an advocate through her journey and what I could have done, I started to feel like this is my purpose. I understand healthcare and I understand people from both sides as a patient and as a doctor and as a system as a whole. So why not create something that hasn't really been done before in this capacity and place a virtual human medical companion in an app in the patient's medical room during their doctor's appointments?
Honestly, I really don't say that. This is brilliant. I can't say this enough to you how brilliant this idea was. And then with everything from your background and putting it into motion, I can't imagine how long this took you. Like, where did you start?
Oh, man. Where did I start? Well, it started with me crying on the floor of my bedroom because I was really sad that I had just lost my grandmother so quickly. I was also very angry at the system that I felt had failed her. It wasn't that she didn't have good doctors. It wasn't that she didn't have support from her family. It was just the system itself just really failed her. And I was so angry and I knew that something needed to change. And I spent several months just researching, trying to find what solutions were out there, and I didn't see it. So eventually one night, I woke up in the middle of the night. I had like this vision of what this could be. And I woke up in the middle of the night. I woke up my husband and I was like, I figured it out. I know what I'm going to do. And it wasn't called Med Companion at the time. I don't know what I was even calling it. But on the back of an electric bill, I woke up. It was like 2 in the morning. And with my husband, I was like, this is what I'm going to do. And I started just writing all of my ideas on the back of that bill. And my husband got really excited. And he's like, that's brilliant. Like, let's do this. But like everything, fear kind of crept in. And I didn't do anything after that. And probably a month later, I was like, you know what? Maybe I'll just register the business. Maybe if I buy the domain and I register my business, like it'll start to feel a little bit real. So I did that. And then I kind of left it alone. I didn't do anything else with that. I was at that time in grad school getting my MBA. And one of the assignments for a class was if you could start any business where resources were unlimited, what would you do? So I once again took that electric bill. I started writing out a business plan and I submitted it. And I get this email from my professor saying that he wanted to talk to me. So I was like, okay, I probably did the assignment wrong. This is what I thought. So I had a moment of panic. And he calls me and he was like, is this business? Is this a real business? And I said, no, it's just something I've been thinking about, something I felt could be beneficial. He's like, I think you should do it. I'm like, you think I should do it? I was like, I've never started a business. I've never owned a business. I never wanted to own a business. Um, and he said, he's like, I think this could make a big difference and you should. And that was just kind of like the sign and the confirmation I had asked God for. And I was like, okay, I'm going to do it. So I took that. And then after that, I just started looking at looking at different components and trying to figure out how to make it work, how to make it secure and safe. That's a big thing in the healthcare system. And that's really where Med Companion originated. I feel like it really just started from that one night. I could still see in my head just me sitting on the floor of my bedroom, just crying and feeling like something had to change and realizing that somebody should do something and that I was somebody.
Something you said at the very beginning really resonated with me with how not only is our system broken, but our system is broken, but it's not because of our doctors and what they do. Because I feel a lot of times doctors get the blame, or maybe even it's a lot of insurance, things you have to go through,
Yeah.
and it's making it harder for people to get the care they deserve. So what do you do to assure the doctors, like, you're here to be a collaborator and not to be a disruptor, so to speak?
Yeah, well, in a way, we are a disruptor in the sense that we're changing how healthcare communicates as a whole because everyone is so siloed. If I go and see my heart doctor does what the heart doctor does. And then if I go and I see my primary care doctor does what the primary care doctor does, but they're not talking to each other. They're
Right.
not communicating to each other. And now there's electronic health records and all of those things, which allows it to be easier to communicate, but they don't always connect. So if I go to one doctor, that doctor may not be able to see my records from another doctor. So it becomes very fragmented.
Mhm.
And one of the things that we do is that when our patients are going to their doctor's appointments and they're utilizing the app and they have their virtual med companion very similar to like FaceTime, pretending you are on FaceTime with someone. They normally put the phone on the counter with the doctors at the doctor's office. The med companion is taking notes and listening, asking questions. They know their patient beforehand, so they know what some of their needs are. They understand what they need to do next. And one of the things we tell doctors is we're here to make sure your patient is able to do all of those things you want them to do once they leave your office.
Mm.
So, if there's anything that you absolutely want your patient to do, this is the time to let us know. And if there's anything that we need to gather for you, whether it's an old record, whether it's a report for an x-ray, like just let us know what you need and we will do that for you. So, it allows the doctor to just feel supported as well because it's one less thing for him or his nurses to do
Mm.
that the virtual ed companion can just take care of. And once that happens, once the patient leaves, we're already working on scheduling that appointment, making sure that they're going to see their nutritionist, making sure their medications arrived at the pharmacy. If there's any issues that come up, maybe the script didn't go through, or maybe there was a glitch in the system, which often happens, and they didn't get the prescription. And we're like, oh, you didn't get the prescription? No problem. We'll call the doctor right away. It gets taken care of. There's no delays in care, which is very important. And doctors are starting to realize how much we're able to do outside of their office that allows their patients to thrive. And for caregivers, we have the ability to incorporate you into this plan. You have the ability to visualize your loved ones' notes, your loved ones' care, and fully understand what's going on with them so that you can better support them.
For the caregivers in particular, what do they because I feel at times too, they're very nervous probably for this service, the first time using this service. What helps your team have the best success with that patient if they are working through my gosh, I'm trying to figure out like the best way to say it because I don't want it to become too
I understand what you're saying.
I can talk on my behalf when I've had to call a doctor over and over again to hear like what the conversation was between my parents and the staff. What steps does a caregiver need to take to make your job easier and a success?
Yeah. Yeah. So for us, it's really the other way around. Our job is to make the job of the caregiver a lot easier. So the less they do, the more empowered we are to do for them. So our role is to make sure that the caregiver stays informed without having to be the person that's making those phone calls to the doctor, without having to be the person that is lost and confused. So, through the notes that we take on behalf of the patient when they're at the medical doctor's appointment, the caregivers can view those. Other things that we do to support patients and their caregivers is once the medical appointment is over, we provide group calls. So if they have family members that they want to be informed of their care, we can host a group call. So it could be Sarah, like you, and let's say it's your mom, and maybe you have a sibling. We'll include the sibling, and we have a conversation where we say, your mom's doctor is concerned that your mom's blood pressure hasn't improved. one of the things he's going to do is he's going to order a blood pressure cuff, and your mom has to record her blood pressure every morning at 8 a.m. before she does anything else. And we're going to make sure your mom understands how to use the blood pressure. We're going to set reminder phone calls at the first week to make sure that she stays consistent. If anything is alarming, we will call her doctor to let her know, like, her blood pressure is extremely high. Is there anything you want her to do? Is there anything she should do? Whether it's going to the doctor or following up with her specialist. So it's really all about the caregivers understanding what is going on with the patient and how to support them. Because if you understand, then you're going to be able to show up better for your loved one.
Yeah, 100%. Have you ever had any patients that have made it a little bit more difficult because maybe they used to do everything on their own and they're worried about like letting that part of them go?
Yeah, yeah. So we've had patients where initially they're probably like, I don't need this service. I've done perfectly fine on my own. I can make my phone call. But once they start working with us, we try to respect their level of autonomy. So if there are certain things that they absolutely want to do, they can still do those. Once they start to see how much we do for them, they start to open up and let go of the things that they're still doing. And eventually it comes to a point where they're like, you could do everything. So it is a process, especially for those that have done it for so long. Once we start doing that for them and they realize how much time they have, they're like, oh, I have time to crochet again, or I have time to play video games because I'm not spending 3 hours on the phone fighting with my insurance because now you're doing that. Mhm.
Totally.
Yeah. And other things that we do is like we handled like their prior authorizations. We make sure that anytime a doctor refers them somewhere that their insurance covers that because that's a big gap that we see is oftentimes doctors are referring patients somewhere without realizing their insurance doesn't cover it. So the patient goes and sees that doctor and now they're stuck with this ridiculous bill that they're like, why am I being charged? My doctor told me to go here. It's like, well, doctors don't deal with insurance. So doctors don't always know
Right.
that insurance does not cover that. So our job as your advocate is to make sure that when you have a referral, that the first thing we do is call your insurance. Hey, this patient was referred to this doctor. Is this covered by your insurance? If not, is there another doctor they should go see? And then communicating with the doctor, like, hey, your referral didn't work under that patient's insurance, but here is one that is covered. Is that okay with you? Is there something better? Do you want us to move forward? So it's really bringing all of those gaps into full circle.
I love that. I think it's really well executed, and I like that there's a start to finish process, and I think that's very helpful for both caregiver and the patient. Now,
Yes.
you said people need advocates by their side. What does it mean to be someone's human prescription?
What does it mean? What do you need? I'm sorry, I didn't.
What does it mean to be someone's like human RX, like that you were talking about? Yeah, their prescription, their human prescription.
Yeah. So, one of the things that has happened through the evolution of healthcare, which has been positive, is there is now more electronic use of different systems, which do help streamline the healthcare system as a whole. However, in that transition, people have forgotten the most important thing, and that is the human connection. And that is really showing up as a human to another human being during their most vulnerable times. And there's so many portals, there are so many softwares, and those are all great. But without a human connection behind it, it's just that. It's just a portal. It's just there. It's not utilized because patients don't know how. So being the human prescription really is we are here not just as another tool, but as a true human being, showing up you as another human being to make sure that you're receiving the care that you need. And we're not just going off a checklist because there are other programs out there that do care coordination, but it's very structured. It's very robotic, almost like, did you take your medication? Great. Did you do this? Great. Did you go here? Great. And it's almost like they're checking off a list
Yeah.
For us, it's more about really understanding that patient as a whole. And we get to know our patients very well. Our med companions make sure that they are connecting with them. It's not just about like, hey, did you take your blood pressure pill? It's more about like, hey, how's your morning going? Oh, that's lovely. You're having a great day. That's wonderful. How's your cat? Oh my God, really? You got another one? That's wonderful. So we're really getting to know them as people, and we get to know their families. We get to interact with grandchildren, their kids. And it's really more about understanding their health needs based on their lifestyle because things change, right? And especially elderly people, most of the time, the most communication they have with anyone is that phone call they get from their med companion on a weekly basis. Of course, we hear about their stories, about their days, about what they're watching on TV. Sometimes they want help sending a text message to their loved ones. So we're walking them through how to do that. So it really becomes more about that human connection aside from just like, hey, let's just go through this checklist and make sure you've done everything. It's like, hey, let's get to know you a little bit better. Let's see what you really need.
Connection is key. Like to any business, I feel connection is key. And treating people like human, I feel that's been a little bit lost because of all the technology. And like technology can be great. Like you said, there's all these incredible softwares, but when it comes down to it, we still need
Yeah.
to connect.
Yeah. Especially when it comes to your health, it's
Yes.
just such a private and vulnerable time that you can't you can't AI that. You can't make it
Mhm.
robotic. You really have to have another human being who understands and holds your hand in the process. And it's like, it's going to be okay. I'm so sorry you're going through that. It's going to be fine. Let's talk about your options. Let's talk about what we can do to help you. And sometimes just having that little support makes such a difference for our patients, is what we've seen.
Okay, so you've done like incredible things in this public health space, but what's the quiet win that nobody saw that still makes you teary when you think about it?
The quiet win for the business or for me or
Open interpretation, my love.
again, I would say that the quiet win for me from a personal standpoint has just been the evolution of embracing the new version of myself that I've had to become to lead a business in this capacity because it's a big undertaking.
Yeah.
So that has been like a quiet win, and people that are closest to me have seen that evolution. And sometimes I have to like take a step back and be like, wow, I am not the same person I was a year ago, or the same girl that was crying in her bedroom when she didn't know what to do. So that has been probably like on a personal level, the biggest win. And I would say from a business standpoint, a quiet win is realizing that I have been able to help people and drive so much impact. Even though I wasn't able to do it for my grandmother, I can now execute and do it for other people where they could have better outcomes and they can have better relationships with their loved ones and their doctors and providers.
I love that you say that. It's not just the relationship with their providers, but it's also with their loved ones too.
Yeah.
That you're helping bring people together again.
Yeah, it's important. We've noticed that oftentimes the reasons why loved ones don't show up for or why caregivers and loved ones don't show up for the patient that's going through it is because they don't understand or they don't know. So sometimes just switching that narrative and giving them the tools that they need to understand and to know allows them to know how to show up for that person, what their true needs are.
Have you had?
Even for me,
Yeah.
I my parents use Med Companion. I have my parents on Med Companion. I'm a very busy person. I don't have time to do it. So they have their Med Companions. And to hear my mom be so excited about her doctor's appointment and say, oh my God, that was so easy which is what we love to hear. Meanwhile, I know that on the back end, my team's like, oh my God, I spent 4 hours dealing with your mom's insurance, right? But
Yeah.
I didn't see that. She's just like, I went to my appointment. It was the best thing ever. And like that is great. That is what we hope to accomplish. And for me, it's like even understanding my mom's needs as she's aging and knowing how to be there for her as a daughter because I understand what's truly going on with her health has been very important and also just very fulfilling for me to be there as a daughter for her during her journey as she's continuing to age.
It must be interesting too having your mom and your dad on Med Companion because I'm sure it's different experiences for them in great ways. But men sometimes, and I told you this, my father had passed away 9 years ago, and the number one thing that I wish I could have done differently was been more of an advocate because he's more of a quiet warrior, and a lot of men are pretty much quiet warriors. They're like, "Oh, you just tell me my information," but they don't necessarily dig deeper or, "Oh, well, he said it was okay, so I think I'm okay." Right? And so what's that experience been, if you don't mind sharing, for your dad as well?
Yeah, so it's interesting that you mention that because men are by far harder to deal with as patients in general. And for my dad, I got him a med companion because it was the exact same thing. Like to him, it's like, I'm fine. I don't really need this. And for him, it started sooner than my mom because we realized what a poor communicator he was with his siblings. But when I first started my business a few years ago, he experienced an injury at work and he went to the doctor. So we're like, okay, great. He went to the doctor. We're all stressed out and worried because we know he was severely injured. And then we talked to him. We're like, Dad, what happened? Are you okay? And he was like, yeah, everything's fine. Like everything's good. I'm like, are you sure? He's like, yeah, but do you know how I can get an appointment to see an orthopedic surgeon? I'm like, wait. So you're telling me everything's okay, but you need to go see a surgeon? I'm like, but something's not okay, Dad. Like, what happened? What did they tell you? He's like, I don't know. They said I was fine. I'm like, they wouldn't say you're fine and send you to the surgeon. So my siblings were so frustrated because this is what we're getting from him. And then I was like, Dad, I'm gonna give you a med companion. Like your next visit, we're gonna make sure you have your orthopedic surgeon appointment. You're gonna go with your med companion. That's not an option, Dad. Like we really need to get to the bottom of this. And he was like, okay, fine. So he went to his orthopedic surgery appointment and brought his med companion. The med companion had this really nice list of all the things that were going on, what he needed to do. And then, of course, it was shared with me and my siblings because we're trying to care for him and know what he needs. And my brother's like, wow, what a difference getting an actual answer versus like everything's fine, but I have to go see all these other people. With men, it requires a little bit more of a push to really get them to do that. And I experienced this even just with my husband. I just got him a med companion because he's been going through some things that and delaying his care. He's like, it's fine. I mean, it's only been going on for 3 months. I'm like, yeah, but that's 3 months
Three
too
months.
long.
Exactly.
You're a doctor. You should know this. So I just got him a med companion, and now he's like, okay, fine. As long as I don't have to schedule my appointment, like I'll go. And most of the time for men, it comes down to that is like they don't have the time or don't want to take out the time to schedule that appointment, or they find like it's a waste of time to do that. So as long as there's somebody there that's doing that for them, it's a big time saver. And my brother also my brother was my first patient. He was my first supporter. At first, I wasn't sure if it was just because he was trying to be a nice brother and support me. But then eventually I started to see that he was like paying for the service and using it a lot. And I called him and I was like, hey, are you trying to support my business or are you really finding value in this? He's like, no, I love this. I have insurance and I don't have time to book my appointments. And most of the time, the reason I don't go to my doctor's appointments is because I don't want to book the appointment. So if I have somebody do it for me and I just show up, then it takes all the guessing work out of it.
That's
And I was like,
awesome.
is that all? Is that all that takes? So he ended up loving it so much. So he was my first patient and he's still a patient. He pays for the service, even though at times I'm like, "You didn't have to pay for it." He's like, "No, no, I want to pay for it. Your team does a great job." And now he got a puppy, and that puppy is also one of our patients because now we handle all of her vet visits
Oh
and
my
booking all
God.
of that and getting all of that. He's like, "I don't like wasting time booking appointments, so I rather pay someone that does it for me and knows what they're doing, so I don't have to do it." So for men, I've noticed that once they understand what Med Companion really does for them and the time savings associated with it, they're
Mhm.
like, "Oh, I just have to show up. Okay, cool. I'll show up to my appointment."
Yeah. Oh, that's so cool.
Yeah.
It's amazing. Your whole family. How's the
Yeah, my whole family is like,
and they love it.
they love the service. I don't even know. Sometimes I'm just like online on our software looking at things, seeing where my team is at, and I'm like, "Oh, my mom had a doctor's appointment. That's great." Like, I don't even know when she's going to the doctor, but my team's on it. So I'm like, I'm sure eventually she'll tell me. And then my siblings and I can see what's going on with her health, and we can see what's going on with my dad's health. And it makes it easy for us as siblings to know how to care for our parents as they're aging, which is phenomenal.
Totally. And that way too, if they tell you something, you don't give them I don't know if this has ever happened to you, but it's definitely happened to me, where you just give unsolicited advice. I'm in the health and wellness space, so I'm like, "Oh, bone density." It's just
Yeah.
the things that come out of your mouth, you don't even realize it because of the
Right.
space you're in. So it's nice to kinda give that to someone
Yeah.
that can be supportive.
It's nice to not be the one that's, like, pulling the information out of the person because that can get very uncomfortable and that can also create a barrier. Whereas, like, now if you all just know the information, you're like, "Hey, mom, I know that you got your DEXA scanned to see your bone density. Do you wanna talk about it? Do you need support in any way?" And it's up to her whether or not she wants my support or my advice. And sometimes she comes to me with questions, and I was like, "That doesn't make sense. Let me pull up your note." "Oh, okay, now I understand what you're saying," because, again, like, she doesn't have the medical terminology knowledge, right? That's a whole separate space, and every time patients go to the doctor, they understand and interpret things based on what they think it means and not necessarily on what it truly means. So I'm like, "That doesn't make sense, mom. I'm pretty sure that's not what your doctor said, but let me just pull up your note and see what you're talking about." And then I can see I'm like, "Oh, no, I see what you understood it that way." And then I can explain things to her. Or if she has questions on how to take a medication or how to she just got a new blood pressure cuff and she had questions on how to use it. She was very proactive and felt very independent that she didn't need me to teach her. She just called her med companion and they walked her through the whole process.
That's
Mm,
cool.
yeah.
When it's all said and done, because you're a mama of 2 beautiful kiddos.
Mhm. Thank you.
You're welcome. What do you hope they will say they learned from watching you navigate owning your own business, starting up your own business, owning a business with both faith, fire, and purpose?
Yeah. I just hope that they would see that mommy just kept going and still made them a priority. So they're still my priority. And I'm trying to show them that you can have all things. You may not have them all at once and you have to make sacrifices. But at the end of the day, like those sacrifices still allowed you to show up. So I'm still a very involved mom. I still prioritize them. But when I can't, I also make it a point that they understand why. So if I'm going to miss an activity at school, I'm like, "You know what? Mommy has to go to this meeting because mommy is going to meet with this doctor so that mommy can help more people." So they're like, "Wow, mommy, that's so cool." And it gives them a reason. Like, mommy is not just like not choosing to go to your play or to
Right.
your activity. It's like mommy is having to go here so that she can continue to help people and still be a good mommy to you later. And sharing that was something that I had to learn how to do because at first they just thought I was stay-at-home mom that did nothing because I work from home. And I remember seeing in one of their cards being like, "My mommy is great because she gets to relax and sleep all day when she's home." And I'm like, "Oh my God, what do my kids' teachers think of me?" And that's when I noticed, I'm like, I'm not including them enough in what I do. So now it's when I include them and they see that, they are more understanding and like why maybe mommy is missing this play, but mommy is able to make their violin concert, or why mommy is sacrificing this, but able to take them to Funzilla another day. So it's always like a trade off. And I want them to remember that, yes, you can do all things and prioritize the things that are important to you while still continuing to move forward.
You still have
And
to
I think that's
bring
important.
your kiddos. You still have your dance parties. You still
Still have a
bake.
dance, still bake for them, still have all my dance parties, and they just kind of know that mommy will always show up one way or another. Whether it's me personally, or maybe I asked my mom to show up because I couldn't be there, or maybe it's my husband showing up. They know that somebody's always going to be there for them. And I love that I get to share this journey now that they're a little bit older and they understand more of the business side and what I do. I've seen how important it is for them to be a part of that journey, whether it's changing the brand colors of the business and them feeling like they gave me some input, or whether it's going to mommy to New York to see mommy on a billboard. And even our Forbes publication, it came out on May 23rd in the morning. And I had a little celebration with my team and the PR team. But at noon, I was mystery reader at my daughter's school. So I could still do both things and I could still prioritize both things. So I think it's just important to keep our boundaries and our priorities in alignment with who we are and where we want to go.
I just I adore you, Marley. Like, this is such a great conversation. I always love mompreneurs that are including their kiddos in the business. And that's something that I'm striving to do, even though my daughter's one, just like explaining to her is like, okay, well, we're getting ready for nap time. Mom has an interview. I have all these toys lined up for you if you want to play with it. And then when you're feeling tired, you just grab your wook woof. Like, it's just so important to explain to them, but keep them a part of the process. I love that you're doing that with your kiddos.
Yeah, and it's all about like the quality over quantity. I'm a big believer in that. So if I'm going to be with my kids, I am with my kids. If we're having a dance party, we're having a dance party. I'm not on the phone trying to have a dance, but I am having a dance party. If we are baking, we're baking. So it really is about that quality over quantity. And I have seen it like now when I see some of like their cards about mom or all about my mommy. And one of the things they write, it's like, my mommy's so cool because she loves me so much and she has her own business. And I see that out there. And I was like, that's something they're proud of. And they talked about it. And I mean, they don't always understand it. Like, I remember my son, after he saw the billboard in Times Square where we all went as a family, he came back and I saw that he dressed up like super nice to go to school. And I was like, what is he doing? Did he need a little girl? And I was like, man, what's going on? He's like, well, mommy, I gotta look so good because now that you're famous, I don't know how my friends are gonna react to this. So in his mind, he's thinking of like, we saw mommy on the screen, so she must be this big deal now. So it's just kind of cute to see what they
Awesome.
interpret and how they see it. But you know what? They see mommy at their highest and her lowest, and they
Yes.
still love me, and I'm still there for them, and they know that. So I think it's so beautiful.
Mhm. Yeah. I'm gonna end with this last question. My favorite one is, how has stress saved your life?
How has stress saved my life? Oh, I would say that stress has been I've had to make stress my best friend.
Mm.
I've had to make stress my best friend because of my background, because of my beginnings and everything that I've gone through. I feel like I've had to learn to thrive in stress. It really drives my fight or flight instinct. I'm also very analytical. So when I'm under a lot of stress, I don't have time to think and overanalyze everything that I do. So I do my best work when I'm stressed. And it's probably not a good thing to do, but going through grad school, I would purposely start assignments at a certain time. So I only had a certain level of hours to get something done, because if I try to be stress-free and calm and sitting in my computer, I would overanalyze it so much that it would become my worst paper, or it would become the
Mhm.
worst thing. So when I am under stress, I can think faster, I can do things without overthinking, I can do things by following my gut and not necessarily overanalyzing and critiquing myself. I just do. So I feel that stress has become a best friend of mine, and I try to keep it under control because too much of it is not good. But when I'm under a little bit of stress, I'm able to do my best work because I'm able to listen to myself and trust myself more than when I'm not.
I love that. See, I have never gotten that answer before. It's very unique perspective. Stress is your bestie. But like
Mm.
you said, just a little bit of it here and there to help drive you forward.
Yeah. And I have to recognize when it's getting out of control, when it's like too
Totally.
much. Okay, this is where I need to meditate. I need to bring it back. But I love to be under some stress. There has to be some stress level for me to kind of get that drive to push forward without overthinking or overanalyzing. It allows me to be like, what is the first thing that comes to my mind? That's what I'm doing. And it makes me a better decision maker.
Marley, how can people get their own med companion?
Yes. Love that question. So, anyone listening that's like, this is for me, or they're not sure if it is, they can go to our website, www.medcompanion.com. At the bottom of that page, there is a form, and it's just your name and your email address and your phone number. Somebody from our team will call you, will understand what your needs are, and then we'll determine whether or not Med Companion is good for you. Some people just really love taking control of their health and they may not need a med companion. But for other people that are struggling, for busy professionals like ourselves whose parents are getting older and need more support, med companion is a really great resource. So if you just fill out the form, somebody from our team will reach out and try to understand what your needs are and how we can support you.
Incredible. Thank you so much, Marley, for your time. How can people also connect with you?
Yeah, people can connect with me personally on Instagram at Marley_Brodsky, or Facebook, Marley Brodsky. I'm in there all the time. So if you ever get a response, it's me. It's not a robot. It's not AI. It's me personally responding to all of the messages that I get. So I would love to connect. Well,
Incredible. Everyone, please go check out Med Companion. I know I'm going to, after our call, and have a chat with family
yeah.
members about it because I think it's absolutely incredible. The work you're doing is so needed, especially in this time now. And I want you guys to share your takeaways. What did you learn? What's something that you're going to take action in your own health journey? And remember, it's a lot of information, but all you have to do is speak well to yourself and be kind to yourself on this self love journey. Until next time, take care.